Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
COVID-19 can be characterized as a pandemic.
Stay at home.
Stay home, stay safe.
Quite simply, stay at home.
On this Monday night, Canada's first death from COVID-19.
When the COVID-19 pandemic was first detected in Wuhan, China in December 2019, attempts to contain it there failed, allowing the virus to spread to other areas of China and later worldwide, bringing life across most of the world to a near standstill. World leaders became ill. Entire countries were locked down to prevent the spread of infection, and international travel ceased. As most governments struggled to contain the virus, scientists were rushing to identify and find treatments that would work against the disease. By the summer of 2022, the deadly disease had killed more than 2.5 million people and infected at least 116 million worldwide. Trillium Health Partners is one of the largest community-based hospital systems in Canada, comprised of Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Centre. Trillium Health Partners is a teaching hospital affiliated with the University of Toronto and is an associate member of the Toronto Academic Health Science Network. At THP, more than 12,000 employees demonstrated courage, compassion, and excellence since the very onset of the pandemic, going above and beyond to care for our community and each other in the toughest, most unexpected of times. THP was one of the hardest hit hospitals in all of Ontario. When community members were asked to stay home, their team members showed up. They raised their hands and left their loved ones safely at home to face the pandemic head on. Over the last year, THP has treated more than 1,500 inpatients, holding their hands, calming their fears, and being their stand-in family when visitors were asked to stay home. They remained flexible and strong when guidelines changed, rallied together to rise to the call of long-term care homes, provided support to all 19 in Mississauga, developed an in-house COVID-19 lab test, set up 3 assessment centers, 1 pandemic response unit, 2 vaccination clinics, and provided more than 304,000 virtual consults to patients who needed care. Every individual at THP played a crucial role in taking on this pandemic, from frontline workers to support staff to their leadership. Close to 1,000 team members had to learn new skills and were redeployed to support the effort. Despite facing the reality that COVID-19 created, the loss of life, separation from family, and the fear of the unknown, the THP team went above and beyond. When family members couldn't be with their loved ones in the hospital, they held their hands and made sure they weren't alone in the toughest of moments. When the call for help was so overwhelming, they rose out of retirement to step back in, deliver vaccinations, became screeners, and delivered swabs. Legends Row proudly salutes the entire THP team who rose to the occasion in our time of greatest need.